Can you please tell us about a time when you either went above and beyond for a patient or provided compassionate care? By the way, before you answer, this question is like your opportunity to tell them something like super heartwarming that will leave them with a picture of you being like super sweet and have them be like, oh my God, this is what we need. Like, she's going to love this career. She's going to love this job. Like, it's a yes.
Okay. A time I provided really compassionate care and went above and beyond is when I had a COVID patient and he had been in the hospital for over a month, which meant that he had not left his single little room in a month. And he was really sad the whole time I'd been caring for him. He was really down and just was often crying and was sad. He missed his family and he didn't want to be there. And so I went into his room one day and I noticed that there was a giant envelope of photos. And when I say giant, this was like a thick envelope. And his family had sent him this huge envelope of photos of him and his family. And I was so excited for him. I was like, oh my gosh, look, your family sent you this. And he said he was too tired to look through them and that he just felt sad and didn't want to, and he didn't have the energy. And I could tell that he kind of wanted to see them. And so I started like showing them to him. And he started to perk up and smile. However, I had other duties that I had to go to. And so I couldn't show him all of them. So what I ended up doing is I took the tape that I had in my IV start kit and I taped all the photos up, or as many as I could on the wall. So when he was lying in bed, he could look up at them. And so as I started taping them up, I noticed he was like really smiling. And by the time that I was done, he was just crying. And he told me that was the best thing that had happened to him that whole hospital stay. And he hugged me. And that instance just like really reminded me why I'm in this profession. And it was just so fulfilling. And it's something I will never forget.
What if they ask you? So this other one's really common. And this one is the one where you talk about like a really heartwarming story. Like, for example, there was a girl for a peds interview and she was talking, the question is like, it's the above and beyond, like compassionate care one. So she was
Mhm.
talking about like, there was a kid who didn't want to wear their helmet. So like they wouldn't go out to the playroom or whatever. And they found out that the kid really liked cats. So they had the secretary print like little cat stickers and like she put cat
Okay.
stickers like on her badge and stuff and then on the kid's helmet and the kid was so
Yeah.
excited and it gives you
Oh,
like
that's
this
cute.
really sweet like visual image of you like holding that patient's hand or bringing them their favorite whatever like whatever it was like leave them with a visual that makes them go oh my God we need this girl.
Okay. An above and beyond time.
Yeah,
The
something.
only thing I can think of is at my last clinical rotation, we had a patient who was admitted to floor because he had a cardiac catheterization scheduled. And he only spoke Mandarin. So no one else on the unit spoke Mandarin, and I speak Mandarin myself, but only to a very like basic level. But I was able to communicate with him because when we went in, we had to get assigned consent. And he was kind of verbalizing to me that he didn't feel comfortable. He didn't know what was happening. And I was able to get that information because I was speaking Chinese to him. But after that, I walked out of the room and I let my nurse know that he didn't feel comfortable just because he didn't really know the exact information about the procedure. So I actually took it upon myself. I found the physician on the floor because he was still making his, or the surgeon, excuse me, on the floor because he was still making his rounds. And I just let him know that the patient in the room was nervous about the procedure and he wanted to speak more about it. And he was like, okay, I can totally do that. Just give me a few more minutes. And in that time, I actually went and found a translator because my terminology in Mandarin is not great. I'm able to get basics, but after that, that's it. So I got up the translator on the iPad, and by the time I had everything all figured out, surgeon was ready to go. We went into the room and he got more information. And as we were walking out, the patient just like kind of pulled me aside and he told me thank you, and that I was his best friend. So
Oh,
yeah, he ended up actually going through with the catheterization. So that was
that's
cool.
really cute. I like that. Yeah, that's a good one. And
Okay.
like it's really important that you knew like sort of the legal boundary of like when it comes to consent or like explaining some kind of like actual medical care, like medical assessment, you have to use a translator. Yeah.
Yeah.
Cool. Can you please tell me about a time that you had or that you provided compassionate care or went above and beyond for a patient?
Yeah, so I think this is experience. It was one of my first ones. It was I had a patient with he had a rashes all over his body, very painful, very itchy, and he was crying when he first came in because he was an admit during my shift, and then it immediately kind of took a little toll on me because he was kind of the similar age as me. And as I was doing the assessment questions and when it got to the suicide risk, he answered yes to one of the questions where it said he wished that he could fall asleep and then not wake up. So immediately after that, I knew that I wanted to sit down and at least talk to him, see what he's going through, because I already can imagine that it was already painful for him in a physical and mental way. So after we did finish the assessment, I told my nurse I'm gonna go sit down with this patient and talk to him for a little bit because he seems like he's still in distress. And then after I heard his concerns about his body image, how he had a whole life ahead of him, he was in college and he had to put everything on pause because of it, and he felt like it was a burden to his family. And I immediately looked to his bedside table and I saw a Bible. And me, I'm a Catholic, so I offered like, "Do you want me to pray for you? I would love to." And in my head, I've never done this before, and it was outside my comfort zone. But I feel like in that moment, it was something that I knew he would appreciate, and it would help him in a way. So I gave prayers, I gave him reassurance, talked to him, got to know him a little bit, and he was very thankful for that experience. And that's an experience that I probably wouldn't forget because I always realized that, of course, there's the physical aspect of caring for a patient, but there's always the mental aspect because they be in the hospital, they could be going through like their worst days of their life, and it's important to recognize that you should do everything that you can on top of the plan of care.
Okay, good. There's a lot of like genuine heart in that. And I can kind of like picture it as you're saying it. And I think leaving them with that feeling and like picturing him and picturing you there with him, like
Yeah.
those are the like when you're thinking back to an interview, like those are the kind of pictures they'll attach to your name, which is good.
So at that same nursing facility, I had a patient and she was actually paralyzed from the waist down, and she was newly admitted to long-term care. I believe she may have been living at home prior to that. So she was really anxious in this new environment. She had who lived really far away, who also had, so he was just extra busy and not visiting her as often as she had hoped. And she was very coherent, alert and oriented times four. And most of the other patients there had dementia or Alzheimer's. So there wasn't really anyone besides staff that she could connect to. So I would try to at least spend 5 minutes of my time talking to her. And if I had extra time, she liked to have her like legs massaged. So I'd help her with that and put lotion on her legs or help brush her hair if I had any extra time, which it really helped strengthen the bond between us because she had a lot of trust issues because she had a history of sepsis from her urinary catheter. So she had a lot of problems with that, and one day it needed to be changed, and she wouldn't let any of the staff do it. So when I came on shift, I spoke with her and educated her on why it's important that we get it changed and the steps I would do and make sure I was doing the sterile technique just so we could prevent her from getting a UTI. So she let me change it, luckily, because we had that bond. But she just had a very big fear of getting sepsis and dying. I felt like it's like important to build a relationship with your patient and their family too. So you have that trust so that in difficult situations, you can like get through it together.